Well, Americans have been boosting their protein intake for years, but the number of new products promoted with high or added fiber saw a big uptick in the U.S. this year. A lot of videos on social media celebrate the benefits of dietary fiber and share recipes to help viewers get more of it. There's even a term for trying to meet or exceed the recommended daily intake. It's called Fibermaxxing. And for more on this, we want to bring in Dr. Michael Kachmar, a bariatric surgeon and weight loss expert at TGH and USF Health. He's also an assistant professor of surgery with USF Health. So thanks so much for being with us, Doctor.
Thanks so much for having me, Ali. Really appreciate it.
Of course. I got to ask you first and foremost, do you agree with this concept of fibermaxxing? And if so, why is fiber so important?
Yeah, absolutely. Honestly, I get why people are talking about it. Most Americans barely get about half the fiber they need every day. And increasing your fiber is a good thing because fiber really does help with your blood glucose, your cholesterol, and can give you a mild sense of fullness and really contribute to improving your overall gut health. But I think pushing too much fiber too quickly for most people can be a recipe for some pretty disastrous GI side effects. You really need to increase things slowly and not go from like 0 to 60 overnight. And make sure that you're drinking plenty of water as you start to increase your daily fiber intake.
I don't think we ever want to hear the words disastrous paired with GI. So tell us how GLP-1 drugs may have actually played a role in this renewed focus on fiber.
For sure. So I think there's some confusion out there about how GLP-1 drugs and the GLP-1 medications work. It's true that GLP-1 medications do slow GI transit and stomach emptying a bit, but sometimes people can pair this to the feeling that you get from a high fiber meal. However, the main effect of GLP-1s is actually in your brain, where it tones down those hunger signals and really elevates all of the signals that enhance fullness. While there's some evidence to suggest that having a healthy amount of fiber in your diet will increase your own body's ability to create GLP-1. It's never to the same level that you get from taking a medication or having a metabolic and bariatric surgery. So the comparison, I think, between fiber and GLP-1 is not truly accurate.
Okay, that's some good information there. What would you say are some other things that people can consider when it comes to weight loss?
So certainly fiber is great for a short-term sense of fullness, so is protein. But I think really the important thing to know about obesity and weight loss when you have chronic obesity is that many times exercise and diet are just not enough because obesity is a chronic disease that requires a comprehensive treatment plan from medical professionals with both medical and surgical options. So while some important improvements in your diet are great for your overall health, if you don't see those pounds coming off on the scale, I don't want patients to get discouraged. I want them to come and seek medical help for a medical problem.
Yeah, because that can be so discouraging for sure when you're not seeing those results and you're trying so hard. I want to end with this then. What would you say is the most important message that you wish to share with our viewers when it comes to weight loss?
Absolutely. So I think trends kind of come and go. We've seen, South Beach diet, low carbs, high protein, low fats, high fiber. All of these are important parts of a healthy diet, but again, making small changes over the course of a long period of time to develop a healthy diet in general is the best thing you can do for your health. However, there's not like a magic ingredient. So just adding fiber and really taking it to the max is probably not going to get you in the long run to where you want to be. But an overall comprehensive plan that might include behavioral changes, medications, and or even surgery tend to work the best for long-term weight management. And there's evidence-based tools that we can, really help patients with. So we're happy to try to get them to their goals.
That's some really good advice there. Baby steps for long-term goals and results. Dr. Kachmar, thank you so much again for your time and insight. We appreciate you being on with us.
Thank you.